Typhoid is an infectious bacterial disease that mainly spreads through contaminated food or water. It can also spread due to poor hygienic conditions. Salmonella Typhi is the bacterium responsible for this disease, and humans are the only carriers. The first case of typhoid fever was reported in the United States in the early 1900s. This microbe is the causative agent of the disease. It is a gram-negative bacterium characterized by a thin cell wall and an outer membrane. The cells are reddish in color, with some having black stains in the center. It is rod-shaped and grows in the small intestine of the human body. Human beings are the main hosts of these bacteria. This species can survive in oxygen-rich environments and is also found in sewage, water bodies, and some food we consume. The bacteria enter the human body through contaminated food and water, where they then invade the intestinal cells. Later, they pass through the bloodstream, destroy the lymphatic system, and spread throughout the body. This bacterium is mainly carried by the white blood cells present in the liver and bone marrow. There, they multiply and re-enter the blood cells, which in turn causes several symptoms to appear in the later stages. There are various symptoms associated with a typhoid infection. They can include high fever, abdominal pain, diarrhea, headache, nausea, constipation, and in some cases, a rash. Those living in areas with poor sanitation practices and a lack of access to clean water are most likely to contract the bacterium that causes typhoid. Children are considered more at risk than adults because their immune systems have yet to be fully developed. However, children often experience less severe symptoms if they do have typhoid. Adults with weakened immune systems are the most at risk for severe illness and life-threatening typhoid complications. These symptoms can be either mild or severe. If the infection is left untreated, it can progress into worsened symptoms and severe health complications that can be fatal. To diagnose typhoid, samples of blood, feces, or urine are taken and examined microscopically to detect the presence of Salmonella Typhi. Sanitation is one of the most important ways to prevent the infection of such diseases. The use of antibiotics can also help kill the disease-causing bacteria. Maintaining good and hygienic food habits can significantly reduce the risk of contracting typhoid. Other ways to avoid infection include eating only properly cooked food that is still hot when served, avoiding raw milk products, and not adding ice to drinks unless it is made from safe water. Boiling water or disinfecting it with a slow-release disinfectant before consumption is recommended. Practicing good hand-washing habits, especially after coming into contact with pets, farm animals, or after using the washroom, is essential. Washing all produce carefully and peeling when possible can further reduce the risk of infection.